I am Adolph Rubinstein. I live in Buenos Aires, Argentina. I'm a family doctor. I'm also trained as epidemiologist, and I'm now running a new project which is funded by NHLBI, and it's called the Southern Cone American Center of Cardiovascular Health, which is based on the Institute for Clinical Effectiveness and Health Policy in Argentina, but has four different partners: the Tulane School of Public Health and Tropical Medicine in New Orleans, USA, the Universidad de la Frontera in Temuco, Chile, and the University of La República in Montevideo, Uruguay. In the last 20 years, chronic disease has increased very much in the Southern Cone, and now they are accounting for by more than 60% of the causes of death and disability. For instance, cardiovascular disease is now the first cause of death. 75% is mainly caused by modified risk factors like tobacco, unhealthy diet, low physical activity, high blood pressure, high cholesterol, and diabetes. Now we are going to start a project that it's related to detection of those risk factors that I mentioned, and to see and to explore the how they produce cardiovascular disease in our region. We have very good data about the frequency and the distribution of risk factors in our countries, but we really don't know the impact of those risk factors in the cardiovascular health of our population. So we are going to conduct one of the first studies in Latin America that will try to explore the relationship, the association between risk factor and cardiovascular disease, which is, for instance, myocardial infarction and stroke. By knowing how those risk factors mentioned before affect cardiovascular disease in our region, we're going to know how to design interventions and strategies to modify lifestyle and to try to make those people healthier. We are starting with training programs at different levels. Now we just started the first master's programs that will have an orientation to cardiovascular health. And now we are sending our first postdoc trainee to Tulane University to make the first postdoctoral year. So we are now building research capacity in our center. Our hopes are by producing this new regional evidence of how risk factors affect people in terms of frequency of chronic diseases. We really hope to convince, firstly, the population to make them aware of what are the risk factors that have to be modified. And this has to do with lifestyle changes, diet, physical activity, and tobacco. But also to convince policymakers to assign the necessary resources to make the interventions to combat chronic diseases at a more broader level.